Thank you for joining us this live with Miami's Community News. And our guest today is Juan Medina, who is a mental health service coordinator at Face to Face Mental Health Services, and Fernando Schutt, who is the clinical director. So in this time of COVID, there's so much stress that is going on, and people are demonstrating in so many ways. And we look at the kids who's now, some is 10 and 20% of their life, the little kids like this, and the parents working, not working, in groups, not groups, working from home, wondering about, if there's enough food, if there's enough money. So obviously that affects people's psyches, right? Mm-hmm. So let's talk about, again, with face-to-face mental health services, the things that you provide and service that you provide for patients and people in Miami-Dade County.
Okay, good afternoon, and thank you for having me here and for having us. And yes, of course, in COVID times, we had a lot of change in the life of people, and very interesting changes. And some of them are just complicated for the life of the people,
yes,
especially for the kids. And for teachers and parents. We went through a very different way of life since all this time, since the pandemic, and that produced a lot of anxiety and in kids and parents also. Imagine when you have a family that the mom has to work and the kids are at home and they are not going anywhere, and you have to take care of them. They have to go to the classes online and everybody's there, and that's produced a lot of stress.
Yes.
Also, social life, it's affected in this way also, because the kids are missing the relationship with other kids that they have at school, and they suffer that.
And Juan, this disease is known as a disease of loneliness, where people that are in the hospital,
right,
they've been in the past have been without their family there, and then if they're at home, they're in quarantine. All right, and it causes a lot of stress on everybody. So, what are some of the symptoms that people show when they show up at your facility? What is it that they're feeling, and how do you help them?
So thank you so much for having us over here. Again, it's an honor to be here. Answering your question, one of the most common symptoms that they usually have, it's depression, anxiety, and actually the numbers have raised of kids about to commit, with ideations of suicidal because of the stress that is generated. In which ways do we help them? We have many services, but for those kids, depending on what is the diagnosis, we provide either group therapy or the actual psychotherapy, or if they need a psychiatric evaluation, we also provide that to them.
One of the things that I believe there's still a stigma of that you've got an emotional issue. You break your hand, I was out, water skiing and I ripped my hand like this, or I was out lifting weights, I ripped my knee out. And in some circles, that's almost, bragging about it. But I don't know that anybody's happily say, hey, by the way, I'm depressed or I'm anxious, what have you. But it has shifted a little bit, certainly with the pandemic. You're a lot on the clinical end. So is there a little bit more acceptance, or is that just in my imagination?
There is a lot of stigma yet about the mental health illnesses, and people used to hide it a lot. However, we have to recognize that there were a little shift, and there are certain people not hiding that any longer in the way that it was before. However, still a lot of stigma around mental health issues. People, yes.
Yeah, so we know there's the admitting into local hospitals and facilities for depression, drug abuse is way up, suicide is up, definitely. Anxiety is way up, everything, all right? Because this has been going on for almost 2 years, all right?
Yes.
And we still have a little ways to go,
definitely.
Right? Yeah. And so if there's anybody out right there right now that's having a problem, listen, dial 211, walk into the police station, walk into a fire station, walk into a hospital, do something, and it's going to get better. You don't have to worry about it, but just pause, all right, and find somebody that will listen to you to move forward. Mm-hmm. And so, and by the way, I think it is our obligation to help people when they're having this type of issue, because the emotional stigma to it, so many people are afraid to say something. Mm-hmm. But you've both been involved in group therapy and single therapy sessions. What is it that an observer, a parent, a sister, a brother, a leader how could they check in with their friends to see how they are doing? What's a good way for them to do that?
Well, there are many different kind of signals that we need to check, especially when we are at home with kids,
Yes.
right? Isolation is one of the most important issues that we have to check about. Right now, with the pandemic, we used to stay in front of a computer long times, and isolation sometimes come like in a camouflage way because we don't realize that people is isolating a lot. Right? That's something that we have to pay attention. Also, we have to pay attention to the kids that are having a lot of changes in their behavior, right? And there is a point that I would like to highlight that for me it's very important. What happened with the pandemic, it is the acceleration of something that was being preparing, or our society was being preparing for a long time, which is to go online in many things. So I remember like 2 or 3 years ago, when I was applying for the renewal of my license, the government was asking me uh, if I was ready to see people throughout internet using telehealth and why I was not doing that. And that's just, I'm telling this because it's just an anticipation of what the pandemic launched in a way that it was unexpected. All right. So the life of people change a lot, and the values and the way of thinking relationships and the way of thinking work on
Yeah.
consuming things, or a lot of things changing, and many people is making a lot of questions for themselves about these kind of things.
That's for you.
Yeah.
So
So
so people get isolated with this because they're
yes.
afraid, and that the parents are not as close because they're concerned about giving it to each other, and also the person that's feeling the anxiety might find some solace in being alone. But
Mhm.
the reality is that's just part of that, and getting better is being able to communicate with people.
Yes. Yes.
So with face-to-face mental health services, your facility is South End 152nd Street area.
Exactly.
Yes.
And what is the area that you typically service? Where do your patients come from?
So thank you so much. So most of our patients they come from the area. However, due to the telehealth,
Mhm.
that's an amazing help that now have. So you can pretty much be anywhere. You just need a phone or any device that has internet access, and you connect, and the therapist will provide the therapy through it. Even the
Mhm.
psychiatric evaluations, the follow up. So it is a blessing that we learn through these times of COVID. Like when people were needed the most, like we use the technology to our advantage. So instead of putting us apart, it actually brought us
Mhm.
together
That
in a
is an
sense.
amazing thing that came out of this about
Exactly.
Definitely.
how we're
Mhm.
communicating and how we're talking with
Mhm.
each other. We know there's been a couple Olympians recently that just came out and said, "Listen, I'm just a human being, all right?"
Mhm.
And you see the stress that
Yeah.
some of the most medaled Olympians in history. The two gymnasts came out and said, it's like this is really tough. And I think there
Mhm.
was the tennis player. That's all that stress, all right? And then the COVID and all the family and friends that we've had that have been sick.
Mhm.
In Dade County, some 50,000, I mean, throughout the state, 50,000 people have died from
Mm,
that,
yeah.
right?
Mhm.
Throughout the country, 600 plus thousand. Their moms, dads, sisters, brothers, caregivers. And we recognize that a lot of the people that died had young children,
Yes.
right?
Mhm.
And how terrible is that? So they lost a parent, maybe both,
Mm.
or an aunt or uncle or a caregiver. So here they
Yes.
are, thinking the world is going to go a certain way. So let's talk about with young children being hospitalized.
Mhm.
You have experience with that. What is that like when you look at it and you take your hat off, all right, your clinician hat, and you look at this poor child over here that's really stressed out? What does that do to you as you take your hat off?
Okay. So the main important thing it is when we are in front of the client, we don't have to take our hat off
Yes.
because otherwise we cannot help them. But let me tell you, the situation is really, really hard. We have all kind of issues related with kids, and it's very hard because in addition to the issues that we can see, we have to improvise the way to respond to that because this is something that we were not expecting.
Yeah.
The situation that you were talking about, suddenly having a kid that he lost her parents and how to react to that and how to accommodate from now on for the kid. It's something that it is totally new and unexpected. So we have to think a lot out of the box, right? And in this situation, put us in a very particular position, and it is very hard as a professional to see that, there are kids that they lost their parents, and we have to work with them.
So we need so often we do need to check in with our family and with young children. How are you doing, etc. We had a when I used to run a lot long distances, we had always check with each other when we were running. And so one day, one of my partners said, "How you doing?" First time in 25 years, and not good. It was so hard for me to say that. Right? It's like, okay, when you say that, what have you admitted to yourself? And he says, "Okay, let's just stop." We sat down on a bench for 30 minutes, and then we finished. All right. During that 30 minutes, as I was recovering, I'm thinking, aren't I lucky to have somebody that cared enough, that reached out, all right, that understood it? That was 10 years ago. We were talking about it the other day when he had COVID, right? And how he stood by me during my time of need, although it was at an event. We do need to check in, even for the guys that are pounding their chests, all right? And we see, so often that people are under this stress. Well, what is it that we can say, Juan, to somebody just to check in with them, other than, hey, what's up? All right. What is it we can say? Some penetrating questions so we can sort of like get to where they're at to see if they need somebody to talk to.
Well, first of all, it's kind of hard because, as you stated, people is not used to saying how they're feeling because they're afraid that they could be misjudged for feeling X, Y, or Z. However, some of the questions are as simple, hey, how are you? Or just by observing, or sometimes you don't even have to be there. Just let me, I'm here for you. All of those things would actually open up, the person would open up with you. And I would just recommend you to just listen. Take 5 minutes and just even stay quiet with them and let them express, let them vent all of those storms within them. And that's really, really, really helpful.
Go ahead.
I think one of the, more important than what are you going to ask to the person, it is how are you going to be ready to hear the person. The most you pay attention to what the person wants to say to you, the most you show that you are there to pay attention to them, to hear them, to take care of what they are saying, it's going to be the best way to assess what's going on and to help that person.
I was at a physician recently, and one of the questions they asked, "How are you feeling? All right, are you depressed? Are you suicidal?" And it was like, wow, those are great questions to ask because maybe somebody will fess up to what's going on. So my congratulations to the medical community for getting that built into there. And we obviously know that listening is very, very important.
Yes.
And so many of us don't listen. I include myself in that. You say, "How are you?" as you're passing in the hallway. And then by the time you're down at the waterfall, "Oh, I'm all right." Right? So when we ask, we really have to be sincere about it. And I think that's an important thing.
Well, that's a professional assessment that you are talking about, which is different than an approach that we have as friends. Sometimes it's a little sensitive to ask as a friend those kind of questions. But I'm also very glad that many professionals in the medical community are including those kind of questions that they weren't included before. And now we realize a few years ago, I could say, that it is important to ask those questions when we are assessing the client.
A year and a half ago, we had Alex Pinellas, former mayor of Miami-Dade County, come speak, and we discussed it ahead of time. He was talking about mental health because his brother was schizophrenic and who ultimately killed himself, and he spoke openly about this. And there were about 100 people in the room. There wasn't a dry eye there, and he talks frequently about how helpless he felt in that, in trying to help people. And sometimes it's obviously out of our control. And people need to go to the professionals to get that guidance and to get help, right? So, at what point should a family member, when they realize there's a problem with one of their children or their partner, and take that next step and trying to get professional help? Is there some signal, say, this is it, let's go to the hospital now? What do you think?
So we I think that we can split your question in two different parts. One it is when to go to the hospital, and the other one it is when to go and
Seek
look for
help.
services for that person.
Yes.
Right? We go to the hospital. It's very clear when we see that the person is dangerous for himself or for others. When we feel that that person can be dangerous for himself or for others, that's a moment to go to the hospital right away. And if a person do not want to go to the hospital, it is the moment to call 911 and tell whatever is going on.
Right.
But basically, that's an emergency
Yes.
situation. Talking about regular situation,
Yes.
whenever we feel that we or the person that we care about is not functioning well in any way, that's the moment to request help to assess what's going on, right? So let's say that you have a kid and suddenly he's falling at school. He was doing great, but now he's falling. That's a good moment to ask what's going on, right? So for sure, you're going to find something. Many
Yeah.
things like this that you can observe that the behavior or the
Changes.
situation or the way of living of the person is changing and he or she is failing a little bit in something.
So in this time of COVID, I know that there will be long-term consequences emotionally
For
for
sure.
most of us. All right,
Yes.
and part of that is to be able to talk with your spouse and your children, and to sort of check it out, and then be able to be a little more comfortable with being uncomfortable.
Mhm.
Yes.
And so how do we do that? Right?
So basically, I mean, we're already doing it. Those are one of those things that you just have to go with the flow. Like at the moment, we have learned that it's okay not to be okay, because if there's a song that goes like that, it's okay not to be okay. Everybody's just full of depression, full of anxiety, because at the end, what's anxiety? You don't know what's going to happen in your future, so you become anxious because you want to control that. So COVID, family, finances, and means, those are things that actually get you all of that anxiety. So how do you do that? How do you tell your partner just like that, hey, I don't think I'm feeling okay, hey, I'm feeling some type of way? Just be honest. Being honest, it will bring healing into your heart and will actually help you by getting that help that you need.
So
Mhm.
again, it's talking about stigmas, and I used to be a registered nurse, and I spent a lot of time working at Jackson Hospital. This is
Uh-huh.
decades ago. And I said to my psychiatrist at that point, I said, me and them, we're the same. The only difference is I got a key.
That's it.
Uh-huh.
And he goes, well, that's the difference.
Yeah.
So it's your coping mechanisms
Exactly.
and how you can deal with it, whatever it happens to be. And we understand being able to talk to somebody is a wonderful thing, and to find somebody that you're trusting. So let's talk about people that are demonstrating their anxiety and depression by using a lot of drugs and alcohol, overeating. All right, we don't know about overeating in this building here. All right, so
I could talk about overeating a lot.
so there are lots of people like that. All right,
Yeah.
Yes.
that they try to numb themselves with the alcohol. And tell us about your experience in this arena about drug or alcohol abuse and what it does to the soul.
Well, when the people it when the people start drinking or using drugs in an excessive way, they start feeling the devastation that the drug or the alcohol is producing in their life. And I mean, we are lucky when they start feeling that devastation, because that's the moment they come to the office or they come to somebody
Exactly.
to do something, all right, to start working about that. But the problem is, for many time, for a long period of time, uh, those drugs usually brings to the people certain kind of satisfaction, immediate satisfaction, and then followed by uh, terrible, terrible
Consequences.
um,
The consequences
consequences. Yes, and
after
then
the
a hangover.
So
All right, so
I come from a place where I think that somebody that's an alcoholic or drunk has to be laying on the ground vomiting. And when I
yes,
was talking to a police chief one day, he said, Michael,
yes,
thinking that's the only way is like saying that a robber has to have a gun in his hand pointing at you. They don't wear a sign that says,
They
I'm
say,
a
"I'm a
robber.
robber."
no,
All right.
right,
So we have all these ailments, maladies that we demonstrated. And I've known people that have been abusive with drugs, a few with alcohol. and you see the cycle like this.
Mm-hmm.
And I get a call one time in the middle of the night, Michael, you got to come take me to the hospital.
Right.
Okay. So I go over there,
Mhm.
and he said, I need to go into rehab. I said,
Mhm.
well, where's your sponsor? All right.
Mm-hmm.
Well, no, I can't. What's his phone number? He won't give it to me.
Mm-hmm.
All right. And I said, well, he wouldn't let me in his house because he was a hoarder and the house stunk alcohol.
Mm-hmm.
Right. And I was able to, and I thought, just have a cup of coffee and you'll be fine. I didn't know all that other stuff that was there. Right.
Right.
So he wound up going to rehab and eventually is dealing with it. But most of us don't know that side of that of those illnesses. So let's talk, if we could, to people that don't have alcohol abuse and drug abuse. What is it they might be doing so that they might be able to take a look at themselves or their family and say, hey, this is how they're acting out. What are some of the signs for us?
Well, again, most of the signs that we're gonna see are related with changes, very important changes in the behavior. For example, missing their job, not going to the school, not going to their job, not sleeping well, waking up earlier, and a change in their mood. That's another very important sign. A mood change, an important mood change. They get angry very easily. They get involved in fights without a lot of sense. So we're gonna see all those kind of things, and of course, it depends of the drug that they are using.
Right.
You're gonna see different signs. For example, people smoking weed or marijuana a lot, you're gonna see that they go a lot of to the refrigerator and eats a lot and sleep. That's part of the side effects
Oh, the,
of the marijuana or weed, whatever you want to call, right? So people using cocaine, you're gonna see them that they are a lot of with a lot of acceleration, very impulsive behavior. So you can see the difference. And basically with alcohol, you're gonna see it depends also what kind of drink they are
Yeah.
taking, but they usually get very angry very easily. They have mood changes.
And so you have that extreme,
Yes.
and then you have people in the middle like this. Okay, all right, this moment I'm up and down and up and down. We try to make the highs not too much and the lows not too much.
Yeah.
But let's talk about therapy at your facility, face to face.
Mhm.
You have individual therapy, or does that take place at your facility, or they can be by telehealth, right?
Oh,
And,
Both of them.
both.
Right.
Yes.
and tell us about the group
Mhm.
therapy when you have that. How do people get accustomed to sitting in this room with 5 or 10 people or whatever it
Mhm.
is, and confess, if you will?
Oh,
What is that? What is that like?
go ahead if you want.
What is that like? So it takes a lot of courage. And one of the things that we do is that we try to encourage them to understand that we all have a situation. It's not a problem. We're all going through a situation, a moment that it's okay not to be okay. So when they do admit, okay, I have a situation, we try to encourage the speaking of it, right? By, okay, I have gone through that, I have gone through that. So when they do happen, they speak, it's really emotional. Like when that happens, like we even clap at them because it takes a lot of courage to actually recognize that you have a situation. Fernando has a lot of experience with these groups and would like to share
Yes, I mean,
personal.
but basically, we cannot generalize because we have very different reactions. There are
Everyone's
many
different.
people coming into the group not recognizing that they are really going through an issue.
Right.
Sometimes they are sent by their family. Sometimes they come for a legal issue, from probably they have a pre-trial agreement, a DUI,
Yeah.
or something like this that are sending them, and they show a lot of resistance in the group. Now, the coercion of the group works very well because usually you have people, other people, seeing the other people as in the mirror, and they can recognize what is going
Right.
on with them in the other. And then you have somebody saying, okay, but you are having this, which is what happened to me. And something happens with the group that it doesn't happen in the individual therapy.
So there's some dynamics that occur where there's empathy,
There's
Yes.
empathy for sure.
right? And it's like, oh man, I want to be in a tribe. I want to be in a group. I want to be similar, just like you do in sports. This is where I go for therapy and to feel better. Typically in groups is what size are those groups typically?
12 people.
Up to
more or
12
less.
people.
Okay,
That's the number. No more than 12 people.
No more than
Right.
12.
Mm-hmm.
so and then there's individual again that they can do in telehealth or in another the
Right.
other
Yes.
place, right? Which
Yes.
is really tremendous. What are some of the other services that you provide, Mon?
Perfect. So we offer the group therapy,
Mhm.
the individual therapy, family counseling. We also provide the psychiatric services that you can get an evaluation, a follow up, and super important. I would love to talk about this, which is the case management service. Like most people, they don't know how important it is to have a case manager when you need it. So if we talk about what's a case manager, so basically it's as simple as saying that it's a mental health provider who works with individual at risk that have been diagnosed with a persistent keyword, persistent and severe mental health condition. How do the case manager help them? So, in simple words, they link the patients with the resources in the community. So, not only coordinating the healthcare, like appointments and all of that, also helps by helping them with the determinants interfering with individual recovery, such as lack of access to transportation, with if they're patients that have an issue with the income, with the housing, with the food, and also any social economic need that the individuals may have.
So when somebody goes to you, you
Mhm.
have somebody that talks to them, figures out where they're at throughout their life. All right. You go through all these questions and
Mhm.
then get them to the help that they need.
Right.
All right.
Yes.
And so I might have mentioned this last time we were here. Uh, there's a woman who brought her son to our third video, and her son had a schizophrenic break about 10 years ago,
Mhm.
and he had recovered, and he came in and he sang a song that he wrote, and he played the guitar,
Mhm.
and it was "You Are Not Alone." The mother was sitting where you are. We're both holding hands, crying like babies. All right, and that's
Yeah.
one of the things that we've seen throughout this pandemic. The peoples are on the edge, and they lots of people want to cry and let it out. That, oh my goodness, what is happening? What have we been through? I want to take a deep breath and be able to understand what's going to happen in the next 6 months or 6 years or whatever it happens to be.
Mhm.
So I'm really pleased that you are helping the people that need it the most. All right.
Yeah.
Mhm.
And one of the things we certainly learned during this pandemic of how medicine was distributed throughout Miami-Dade County, throughout the country, and throughout the world, and who got it first,
Mhm.
and who got it second, and who got it last, and who's still struggling to understand it and to be okay with it because they weren't connected and they were afraid. And their group wasn't doing that, meaning getting the shots. And we've seen CHI, which is Community Health Incorporated down
Right.
south. When they took those vans and they set up pop-up areas and we're doing that, congratulations to them and to the county for making that happen.
Definitely.
In the meanwhile, if you're on the other end of the spectrum, don't worry, come on over and you get the shots. So there are a lot of people that are really disconnected and that haven't figured out how to work within the system. So what is it you're doing at face to face so you can reach out to people and try to communicate with them and say, we can help you? So tell us some of the things that you're doing, if you don't mind, Mon.
Mhm.
Well, some of the things that we do to help them, it's we go to meetings, certain meetings in the community. We provide our services online. Social media now is one of the tools that this, let's call this generation, right, is using to communicate. So we also have a really good system through social media that we provide our services. We show what we offer, where we're located, how we could get them help. There's always pretty much marketing
Mhm.
and providing, being there for them.
When my father had a stroke 20 years ago, it's like, and he was essentially immobile. I went, well, what do I do?
Mhm.
Who do I go to and ask for help?
Right.
And that's what we wanted. Like, get to some place where somebody can say this way for housing, transportation, and for the medical care itself wasn't the problem. It's like, what's next?
Exactly.
Yes.
And so somebody can go to your facility and you can direct them and help them because at the time that they call you,
Oh,
Yes, of course.
that you have that moment to be able to help them.
Yes. So any people that, I mean, when the people get in touch with us, uh, I would say that's exactly when the problem or the issue about how to find resources finish or come to an end, because we have the resources to
that you
tell
were
them
looking
which
for.
are the resources, even if we don't have those resources, because we don't provide everything, but we know where to find it. But the problem that you are mentioned, it is there are people who do not know how to access to those services,
Services.
which is really a very big issue, because there are a lot of people who need services and they don't know how to reach them. Of course, once they have our phone, they know how to reach them. Okay,
Because we let
or
them
they
know.
know, yeah, or they know the, the Miami-Dade County has a number which is the Miami switchboard 211, and when the people know that they can call 211, so then they're gonna receive services. But there are a lot of people who are very disconnected, and it's very hard to reach them.
And we see that. There was a
Yes.
fellow that I know, happened African American, about 60 years old. I said, "Do
Mhm.
you want this month's ago? Do you want an appointment?" Yeah, it's okay. So I made an appointment for him. He comes back a couple days later. I said, "So when's your next appointment?" Because I didn't believe him. And he goes, "They're going to call me." I said, "Get over here." All right. He didn't go.
Yeah.
And so I said to him, "Is this important for you?" Yes. Why is it important? Well, I live with my 80-year-old mother, whatever it was. I said, "So what are you waiting for?" And what it took is that family unit, the mother, the daughter, and him, to go together. They decided together that they would go do it because they were not connected. They just felt isolated with that. And
Mhm.
people that they knew most had not had the injections. And so when I watched that process of figuring out why do you want it, right? It still wasn't strong enough that he
Mhm.
could kill his mother, right? Because of feeling isolated, not educated enough, and being afraid. So we
Mhm.
know a lot of people are afraid to call you, all right?
Yes.
To call anybody, all right? So when they call, how do you get to this next level where they begin to trust you and so they will come in? Is that an issue for you?
Maybe it's because of my personality and how
Mhm.
outgoing I am. But I have, thank God, right? I have had most of the clients that called in, and I guess is they feel like I do want to help them. Is I don't know, a sense of belonging. Like we're talking, we talk about, so how are you doing? So what do you think you need the services? And we kind of have a conversation. And most of them, they pretty much just let me know, hey Juan, I need this. Like I'm feeling this way. I don't know, I don't want to do anything that I'm not supposed to. My kids are driving me crazy, or this or that, or I feel this way or that way. And as soon as we get in contact with them, we make them feel like we're family, and that bondage, that sense of belonging, I would say, is what opened the doors for them to be like, okay, so how do we do this, right? Now thank God we have all these means, because since we're located in Palmetto Bay, they're like, oh, but that's too far for me. Thank God we have telehealth, right? There's always an option, there's always a solution. If it's not us, hey, where do you live by, how do we do this, I know places close by, let's do this. And also the case manager is that person. I'm going back to it. Why? Because it's important. Because the case manager would be that person that will actually link you with those resources that are there for you, and you
Yes.
qualify for them, but you didn't know. And because of it, you're just not eating the cake that was yours, that had your name. You're just leaving it on the table. So that's one of the things that we also do. And going back to the question, how do we do it? It's just
Mhm.
building rapport, putting
So
ourselves in their place, pretty much.
Confidence is paramount here. I mean, that is a professional ability, a professional skill that you need to have to create confidence with the
Right.
people. The people need to trust you. If they don't trust you, it's very hard to work in this profession.
Exactly.
And again, so folks that are suffering right now or think that they can call you at face-to-face mental health
Yes.
services. If it's
Yes.
really urgent, they call 211, walk into the hospital, police station, fire department, 911, whatever it is,
Please,
and
yeah.
get that help if it's an emergency. If you're on that edge, and they can call you and have somebody to talk to and put together a plan of action.
That's exactly what we do. Whenever they call us, we assess them, and they're gonna have a talk face to face. That's our name, with a professional, and that professional will help them to produce a treatment plan or whatever they need. They're gonna
Right.
guide him in the way that they're gonna move in the system with us or without us.
One of the things that a lot of us miss is that face to face. All right.
Mhm.
And we have staff that no longer works here. They work out of their house. And so they're suffering. Staff here is suffering because they're used to that office family that's not there anymore. All right.
Mhm.
And so it's tough for everybody. And so we want people to be a little bit more comfortable, all right, in asking for help. And then you can do that, folks, by calling face to face mental health services. Fernando Schutt, thank you very much for being
Thanks to
here.
you.
Juan Medina, thank you very
It's always
much.
an honor. Thank you for having us.
And again, face-to-face mental health services that in Palmetto Bay down south. You can find them all over the web and everywhere else that you need to find it. I want to thank our studio audience, and it's that Michael Fernandez over there. Thank you very much, folks. Appreciate your time. Remember, if it's an emergency, 211, 911. Take care of yourselves, and thank you for